Indications right now that are telling us that there is a protection against transmission of the disease. There is no variant that we have identified that escapes the protection of our vaccine.
Against COVID, to come now with a treatment of 90% effectiveness, personally makes me very proud about it.
And we know that the two doses of the vaccine offer very limited protection, if any. The 3 doses with a booster, they offer reasonable protection against.
It is necessary a 4th boost right now. The protection that you are getting from the 3rd, it is good enough, actually quite good for hospitalizations and deaths. It's not that good against infections, but doesn't last.
Where I would like a clear answer, please.
So there are no misunderstandings. Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market. And from that point of view, we had to do everything at risk. I think our Dr. Bourla, even though he's not here, would turn around and say to you himself, if not us, then who? Dr. Bourla actually felt the importance of what was going on in the world. And therefore, as a result of that, we actually spent $2 billion at risk of self-funded money from Pfizer to be able to manufacture, first of all, research, develop and manufacture at risk to be able to make sure that we were in a position to be able to help with the pandemic. And I think that's why I feel very good when a recent paper from the Imperial College stated that in the first year of the rollout of vaccines, we saved 4 million people. So from that point of view, I feel that actually we were there when the world needed us to be able to make sure that we were able to help people around the world with vaccination as well as now oral treatment. I would hate to imagine what situation we would be in the world right now if companies like us did not take those risks, did not do clinical research and developments at scale in order to make sure that we could have a vaccine that we could roll out to the world. So I understand your frustrations, I really do. But I also hope at some point somewhere you also do appreciate what pharmaceutical companies have done in order to be able to roll out and deliver vaccines at such speed.